Hi, I'm Paula.
Paula, nice to meet you. Can I have a seat?
Yeah.
Okay. My role here at the hospital is to make sure you guys are as comfortable as possible because we know that hospital stays can get stressful and sometimes boring. So we like to prepare and bring activities to you guys so you don't get bored and make sure that you're understanding exactly what's happening to you during the hospital stay. Okay? Yeah. My job today, I came to talk to you because I heard you're getting an IV start, which can sometimes be scary for someone who hasn't had one. So we like to talk through with the kids and just let them know exactly what's going to happen so they feel as prepared as possible. Does that sound okay if I'm here to prepare you?
Yeah.
Yeah? Okay. How old are you, Sarah?
16.
16. Have you ever been in the hospital before?
No.
No. Have you ever had an IV start?
No.
No. Do you know what it is?
Kinda.
How do you feel like our hospital stay is going?
It's going good so far.
Yeah. Coping well with your new diagnosis? You getting used to it at least a little bit?
Yeah.
Yeah. Okay. Well, I'm going to have some pictures. I'm going to talk you through kind of the basics of what an IV start is going to look like, just so you are aware. You're not completely scared when they come in and try to start it. Have you ever seen like a friend get an IV or one on TV?
I saw one on TV once.
You did? Yeah.
But the blood squirting everywhere, is that going to happen to me?
It shouldn't happen to you. We have great nurses here who...
Can I die?
No. You would have to lose a lot of blood from that first blood squirting everywhere to die. And that's not going to happen because they're going to be right there to put their hand on your arm if it starts bleeding. So you don't have to worry about that, okay?
Okay.
Okay, so what I'm going to do, I'm going to walk you through, I'm going to use my arm to show you kind of exactly what's going to happen. I have some pictures to show you as well. First they're going to come in, it's going to be probably one nurse or lab tech, whoever's available. They're going to come in and they're going to look at your arms. Just what they're looking for is to see if they can see a good vein. Which a good vein means one that they're going to be able to get right away so that they don't have to poke you more than once because they don't want to do that. So they're going to look at both of your arms. They're going to be looking here, here, and the top of your hands. It's most likely going to be placed right here. This is the best place they like to put it. But if they can't get it right there, then they'll try here and here. Okay? Now, when they think they've decided which arm is going to be best, they're going to roll up your sleeve all the way and put this big rubber band. You see the picture right there? It just looks like a big rubber band. I think ours are blue, so they're bright blue rubber bands. And they're just gonna make it, it's gonna be really tight, kind of feel uncomfortable. But it's only gonna be on there for a little bit. And what they're doing is it makes the vein stick out a little taller so that they can see it better. And so they might have you squeeze your hands a little bit just so that they can see the vein. And then they're going, once they find a good spot, they're going to take an alcohol swab and clean your arm really well and get rid of all the germs. And then you see these pictures here. These are different types of IV needles. Now this is the scary part for some kids. They look scary, but they're really not big at all. And later I'll bring one in to show you exactly what it looks like when they told me exactly which one you're going to use. And what they're going to do is they're going to place that in your vein. Now here's the fun fact. Not everybody knows this. That needle doesn't stay in your arm. They take that right out. Just the tube that's on it is going to stay in your arm. So just a plastic little flimsy tube. So the needle comes out and they throw that away. A lot of kids think that the needle stays in and that's super scary to them, but they don't. And then they'll tape that all up and hook you up to these IV tube looking things. And that's where you're going to get your medicine from. And you'll have an IV bag that'll hang on the IV pole. And whether it's fluids to get you hydrated, which means if you're dehydrated, you just haven't drank enough water, which with your new diagnosis, that happens a lot. So that might be a possibility, or if you have to have certain medicines, they can run it through there. So you don't have to take a whole bunch of medicine by mouth, because sometimes that tastes gross. So they'd rather just do it that way. Okay? Does that all make sense to you?
Yeah.
Yeah, do you have any questions?
No.
No. Okay, well, Mom or Sarah, if you guys come up with questions before it actually happens, then feel free to ask us before the procedure, and any one of us can answer that for you, okay? Now, my next question for you is, in your past experience, have you had better luck? Do you feel like you would be more comfortable watching them give you the IV, or looking away?
Can I just like text?
Yeah, definitely. You'll only have one hand. Can you text with one hand? Is that a silly question, Mom? She texts all the time?
All the time.
Okay.
You should see how fast I can text.
You want to show me?
No.
No? Okay. Okay, well, you can show me some other time. But that's good to know, especially during procedures. Mom, you can sit on the opposite side, like if they're going to take it from this arm, and just kind of be there to talk to her, to distract her. Okay? Do you guys have any other questions?
No.
No. Okay. Now, Mom, you might realize that when you see her getting IV, that's kind of stressful to you. Just know that that's normal, and you just need to stay calm to help keep Sarah calm so you guys can get through it. It's really not that bad after you've had your first one. You kind of know what to expect, okay? Okay, do you have any other questions? Do you guys need anything else before I leave?
We're good.
Okay, I think they were ordering your medicine, and then they're going to get the IV start so that they can get you started on your fluids and medicine, okay?
Okay.
All right, thanks, guys.
Thank you.